Hi guys, today I'll be talking about alpha hydroxy acids. What are alpha hydroxy acids? Alpha hydroxy acids, also known as AHAs, are various naturally occurring compounds which come from plant sources including glycolic acid from sugarcane, malic acid from apples, tartaric acid from grapes, and citric acid from lemons. Fruit acids is another name for these acids as they are derived from plant sources. AHAs produce beneficial effects in aging skin, mainly sun-damaged skin caused by excessive sun exposure. AHAs also assist in shedding dead corneocytes in the stratum corneum and promoting cellular renewal. Decreasing corneocyte cohesion in the skin improves overall skin texture, revealing a smoother, softer skin appearance. Lactic acid is also an AHA, however it is developed from sour milk. Lactic acid is commonly used for treating keratinization disorders including ichthyosis, as it assists in maintaining the skin's natural moisturizing factor. Lactic acid has a low discomfort profile with little downtime and risk. It also has a similar structure to glycolic acid without the extra methyl group at the B carbon end. It has a lower pKa and pH than glycolic acid, initiating chemoexfoliation at lower concentrations. Lactic acid causes keratocoagulation of the skin surface. It can be used for superficial hyperpigmentation, photo damage, and fine ripe lines. Signs of skin aging can be improved by using glycolic combined with topical retinoids in skincare products, which assist as a peeling solution. The concentration and pH controls the effects of alpha hydroxy acids. A pH lower than 3.5 can cause side effects including burning, stinging, and irritation. Glycolic acid is a main type of AHA used. However, glycolic acids can also be combined in products with other acids including lactic acid, citric acid, and other acids. Glycolic acid is a superficial peeling agent which is derived from sugarcane. Regarding the chemical structure, it is the smallest AHA and is highly hydrophilic, which means it is attracted to water. Concerns such as mild to moderate photoaging and superficial hyperpigmentation can be improved with superficial exfoliation with glycolic acid at concentrations of 30 to 50%. Unlike lactic acid, glycolic acid needs to be neutralized to slow down keratinocoagulation and prevent it penetrating deeper into the skin. Erythema and frosting are clinical signs of reaction completion, and then the peel can be neutralized with an alkaline neutralizing agent, which can be a sodium bicarbonate neutralization. Neutralization is an exothermic process, therefore during neutralization, transient warmth, stinging, or burning can occur. After treatment, the skin will appear red and some swelling may present. Light patchy frosting, which is a level 1, might occur due to separation of the epidermis from the underlying dermis, otherwise known as epithermolysis. Deeper peels through to the dermis appears as uniform frosting and is not desired. Exfoliation typically occurs over several days and re-epithelialization is complete between 7 to 10 days. AHAs can be used in creams, liquid emulsions, ointments, gels, and cleansers. AHAs incorporated into cleansing products are the least effective than other preparations as they are only applied to the skin for a short period. AHAs are more effective when they are used in greater concentrations and when the pH is lower. There are 3 different concentrations of AHAs and they are low concentrations up to 10%. This concentration is sold in retail stores and supervision from a doctor is not needed. This, however, can vary in other countries as they have different regulations. Concentrations of 10 to 50%. These concentrations need supervision from a professional and cause very superficial skin peeling. A number of treatments are usually needed depending on what's being treated. concentrations of 50 to 70%, a trained professional can only apply these concentrations to cause superficial skin peeling. The concentration, time on the skin, how often AHAs are used, determines the effects on the skin. More beneficial effects are produced with AHAs that have a high concentration. However, side effects including skin irritation are increased. Benefits. So some of the benefits of AHAs include slowing down of the aging process, reduction in fine lines and wrinkles, improvements in skin elasticity, exfoliation of the skin and sloughing off of dead skin cells, improved collagen production, increased skin hydration, improved skin moisture levels, improvements in acne and oily skin types, as well as improvements in skin texture, improved skin discoloration and a more even skin tone, as well as improvements in acne scars. Effects of low concentrations of AHAs. Glycolic acid at low concentrations of up to 10% cause bonds between dead keratinocyte cells of the upper skin layers to weaken, therefore reducing cohesion to the skin. This means the keratinous layer doesn't accumulate with cells and the old cells are peeled away and replaced easily with new cells. A new thinner keratinous layer replaces the old dehydrated damaged keratinous layer. This causes the skin to appear smoother and even. Glycolic acid absorbs water well and therefore acts as a humectant. Therefore, it provides good moisture to the skin, causing swelling of the skin and reduction in fine lines and wrinkles, causing a more smooth skin appearance. Effects of moderate concentration of AHA of 10% to 50% on sun-damaged skin. So the effects on the epidermis. Applying 25% glycolic acid on sun-damaged skin every day over a couple of months causes thickening of the epidermis and textural improvements. The cells are more even in shape and evenly distributed. The overall appearance of the skin is smoother. Excessive sun exposure causes sun damage such as wrinkles from melanin build-up in epidermal cells. Regular epidermal cell turnover improves how our skin looks and reduces wrinkles. The effects on the dermis. Regular use of moderately high concentrations of AHAs cause effects on elastic fibers, as well as improving the quantity of collagen fibers. AHAs are also proposed to reach the dermis and produce new collagen fibers. Applying concentrations of AHAs up to 50% can act as a peeling agent when applied to the skin, causing textural changes in the skin. Treatment effects differ for each person, including level of improvement and presence of adverse reactions. Glycolic acid with a 50% concentration should be applied by a professional or a doctor. Effect of high concentrations of AHA. AHAs with a higher concentration have increased adverse effects such as burns due to the higher acidity level. Medical supervision is needed when using AHAs with a high concentration. Doctors are only required to apply concentrations of 50 to 70% to reduce superficial skin peeling. Applying a chemical peel causes the uppermost layer of the epidermis to dissolve, revealing a new, healthy skin. The occurrence and time the AHA is in contact with the skin determines the effects of the peel. The effects in the epidermis. So regular use of 70% glycolic acid over a couple of months causes changes in the epidermis, including a thicker epidermis and smoother skin with the reduction in wrinkles. In the dermis, the production of new dermal collagen and elastic fibers are improved with use of high concentration of AHAs. Using glycolic acid with a high concentration is primarily used as a peeling agent for improving skin with sun damage. Hyperpigmentation is also improved with these concentrations. Guidelines for use. So begin using a low concentration. Initially, a low concentration AHA of 3 to 4% should be used on the face and neck daily. After a couple of days, this can be increased to twice a day, only if there is the absence of skin irritation. Increase the concentration after a few weeks of use. A high concentration of up to 10% can be used if no side effects occur. Sensitive skin types should patch test the product before using it on the whole face to rule out any adverse effects. To increase skin tolerance, individuals with sensitive skin types should begin using AHAs every second day. If you're also using the exfoliation product or retinoic acid along with the hydroxyl acid, the skin can become more sensitized. And this is just another table, more in depth, explaining how to use alpha hydroxy acids. Combined treatment. So AHAs used together with retinoic acid is believed to improve the effectiveness of the ingredients and improve signs of aging. AHAs can be used during the day, while retinoic acid can be used at night. AHA products or pills can be used in conjunction with various other pills, non-ablative laser, and microdermabrasion to increase its effects. Incorporating microdermabrasion has been revealed to enhance the effects of glycolic acid pills. However, there is also a higher risk of side effects. AHAs for different skin types. There are various AHA compounds that can be used for a range of different skin types. Dry skin types should opt for an oil-based cream, whereas oily skin types should use a gel-based product. Considerations such as the constitution of the vehicle in which the acid is dissolved and how it was prepared determines the effectiveness of the AHA compound. Side effects. Low concentrations of AHAs can cause some side effects, including transient stinging following application, which usually subsides with regular use. Itching, constant stinging, or redness suggests that irritation is due to increased sensitivity to the components of the product. If this occurs, the product should be discontinued immediately. High concentrations of AHAs. Some possible side effects of high concentrations of AHAs can range from minimal irritation with visible redness and stinging to more severe adverse reactions including blistering and burns. AHAs can produce beneficial effects for sun-damaged skin. Other benefits include exfoliation, moisturizing, reduction of fine lines and wrinkles, collagen synthesis, firming, and skin lightening. AHAs have shown to have the greatest benefit in clinical studies in lessening the effects of aging on the skin combined with retinoic acid. AHAs also enhance epidermal proliferation and thickness and improve skin hydration